Hello, my name's Jo Hollidge. I'm Head of Nursing for Intensive Care Theatres, Anaesthetics, Pain and Sleep. Thank you for inviting me to do the presentation, albeit virtually. This is a big focus, although I'm presenting it, this is really the work of a wider MDT, my nurses, medical staff, allied health professionals within the intensive care units with close partnership working with our patient partners. We wanted to make a focus on whether our ICU patients and relatives were really listened to. And we worked with our patient partners to look at ways of providing opportunities for ICU patients in an acute trust to engage with the multidisciplinary team and really ensure that the feedback we were getting was translated into meaningful action. Just generally, our trust is a very large teaching trust spread over 3 sites. As you'll see there, we have the General, the Glenfield and the Leicester Royal Infirmaries. We also work with close partnership with the University of Leicester and De Montfort University. Our patients are at the heart of all we do, and we believe that caring at its best is not just about the treatments and services we provide, but about giving our patients the best possible experience. Just a quick overview there of the Leicester Royal Infirmary. That is our more acute site with a large ED. The Glenfield Hospital has a tertiary cardiothoracic centre, and we are also one of the only centres who provide ECMO for both adults and paediatric patients. At the Leicester General Hospital, we have an intensive care of 12-bedded unit where we treat many electives, specialities very much in renal. We acknowledge that an admission to an intensive care unit via any pathway can be a daunting experience for patients and their loved ones. So collecting feedback really gives us an opportunity to work with a variety of people and patients to see how we can improve. Collecting friends and family feedback at the point of an ICU discharge provides a good opportunity to assess the quality of care and services, but as an MDT, we are very aware that this is often after discharge, and a period of reflection for both patients and families may have many questions and ideas that they wish to share. The patient user days are something that we've been running now for about 3 years. They were quite an innovative response to the reality that we understand that when patients are discharged, that they do have many questions. It takes time to work out and to consider that experience. So we're really lucky that our patient experience group works hard to review all of the feedback and to carefully select and invite patients back some months after the patient discharge. We work with the patient partners who are members of the public, and they've been appointed by the University of Hospitals of Leicester to provide a lay patient and public perspective on issues across all areas of the trust, and the patient user days are led by our patient partners. Using patient partners really enables us, as hard as we may try at times, to move away from some of the clinical context and understanding of our conversations, because it's the reality of what the general public feel, want to know, and want assurance. The initiative came about because we wanted to make a real difference and develop actions that were led and directed by our patients. This initiative has enabled collaborative involvement with the users of our service and enabled a variety of opportunities for us as a team to turn this listening into action. We also wanted to ensure that the many new staff that we have within the ICUs were given a real opportunity to see the value of patient feedback and to ensure as they progress through their careers that this is always of their highest priority. The patient user days are predominantly organised by the senior sisters on the intensive care units who have patient experience as part of their senior responsibilities with the involvement of our patient partners. We normally choose up to 50 patients at random from patients who have been on ICU for more than 48 hours. We apply via charitable funds to provide light refreshments and free car parking passes for the attendees. An appropriate venue is sought by the sisters and booked well in advance of the day. We also, as I said in my previous slide, ensure that more junior members of staff of all bands and grades are invited and involved in these days and are all given little tasks and opportunities to have feedback about the day and to have contact with the patients and relatives. For many of our new Band 5 staff, coming to ITU can be quite a daunting experience, and for them, just feedback from these junior staff has been very valuable in how they've seen the value of their care translated into the experience from patients and relatives. The objectives of the user days, obviously the main focus of the session is to gain feedback about the patient's stay whilst they were with us in ICU and also explore the step down experience to their next area of care. This enables us to obtain their views on their wider hospital experience. To help explain and give answers to questions that arose utilising the ICU and ward teams that attend, and to use the feedback to enhance the ICU ward experience for future patients. We've started to invite staff from the ward areas because what we learnt in the beginning of the patient user days was often there were many questions and some anxieties around that initial discharge to the ward area. This is very much understood because as a patient, if you have a nurse at the end of your bed 24 hours a day, you can understand some of the anxieties of being placed onto a ward or in a 4 or 6 bedded bay. So we've had real value recently of inviting our ward colleagues and forging those closer relationships about supporting the patients and relatives prior to discharge to the ward area. Other objectives of the user days, our patient partners lead the session and focus on the following areas for patients to provide feedback. So we talk about the preoperative experience, the ICU stay experience, ward and discharge experience, and the themes of communication, medical and nursing staff environment are also discussed. The day works, the room is set up with tables, each with a member of staff on it, so that we're able to discuss issues with the patients and then help feedback to the whole group. This approach has proven to work really well. The patient partners normally stand at the front and lead the questions and capture all feedback on flip charts. All of the feedback is then viewed by the ICU multidisciplinary teams and patient partners to devise clear actions and feedback. At the end of the session, we always invite the attendees to complete an evaluation form, and to date, these have always been rated as good and very good. Obviously, as an aside, the challenges of COVID and now having meetings as such are going to be difficult, but this isn't to say that we've discarded these meetings. We're working very hard at the minute to look at how we will set up virtual meetings from patients last year, and over the next few weeks we have a virtual Memorial Day set up with a service being led by one of our chaplains so that patients from last year and their relatives can have time of reflection. So we will be working on a virtual invite. Impact and results achieved. The initiatives have seen many positive changes to improve our patients' and loved ones' ICU experience. As a result of the feedback, to name but a few, we have introduced the following: diaries for patients to keep their day recorded, and then we're able to feedback any gaps that those patients may have had. These we've found on reflection during the COVID surge have been so valuable to our relatives and loved ones who were unable to attend the hospital. The 15 Steps Challenge, this is where we did a walkthrough of a patient pathway within our ICUs to identify improvements that can be made to enhance the service experience. As we all know, first impressions leave an impacting impression upon you, and we've worked very hard with our patient partners to make ICU areas as inviting as they possibly can be. Also, we've had a great success with Scylla, our pet dog, Pets as Therapy Dogs, who visits and spends time with our ICU patients. This has really, really helped with our patients' anxieties. The ICU Memorial Afternoons, as I just alluded to, as we're now planning a memorial one, are held twice yearly, and relatives and loved ones of patients that have sadly passed away in critical care are invited to attend our cross-site memorial afternoon. This is an opportunity for relatives to remember their loved ones and talk to the staff who are involved in their care, given the opportunity to answer any questions. The unit provides an afternoon tea, and the volunteer services kindly attend and offer hand massages and a listening ear. Relatives are also invited to write messages to their loved ones on our biodegradable tags to be displayed on our memory tree, and balloons are released. Measuring success. We measure success of the initiative by monitoring our friends and family test scores monthly. We look at direct feedback, message to matron cards, feedback at follow-up clinics, and the all-important patient feedback following some of the improvements above. We've seen over the last 12 months an FFT score of between 97 to 100% of returns recommending our ICUs. We have seen few complaints, and the promotion of our collaborative working with our patients and patient partners has seen a positive impact on recruitment and retention, low turnover, and all units being fully recruited too. Here is a slide where we just wanted to pass on some of the comments from our patients. I always think that it's very difficult to respond to a question asking if you would recommend ICU. Obviously, many of us wouldn't want to recommend any of our loved ones being in an intensive care. But I think just looking at the slide and the overall recommendations of nearly 100%, and the feedback about the excellent care and that nothing was too much trouble for the staff, really does help to steer our pathway to success to improve what is always going to be a difficult experience for patients and relatives. As I've alluded to in the last slide, recruitment and retention is also really, really important. ICU teams work as close families, and ensuring you support your new staff, whether they be junior or new senior staff to your unit of all grades and of all parts of the multidisciplinary team. This involvement really, really helps them to reflect on the care they're giving and to think about other projects that they'd like to work on from patient feedback, and we always encourage a wide involvement. What makes this initiative stand out? The key elements to its success are the dedication of the MDT and the patient partners to truly listen to their patients and have a dedication and passion to make improvements. The staff also feedback that the user day really helps them to define their roles and focus on success and improvement, be it the smallest things that are always often the most important to our patients and families. Key learning points for you. Do not be fearful of holding such an event. Remember, all feedback is valuable and we learn from the positives and the negatives. Quick wins are often those that we just never noticed. It's a big morale booster. You must have dedicated leads to organise the user days and always check the NHS spine to ensure no invite letters are sent to those patients that may have sadly passed away post-discharge. Get your patient partners involved as they provide an independent lead, provide an update on actions to those that attended, and use an evaluation sheet at the end of the session.